Your memory may not be failing because of age. That sudden brain fog, that confusion in the afternoon, that moment when you walk into a room and forget why you came there, that familiar name that disappears from your mind, that sleepiness, dizziness, or strange mental dullness your family keeps calling normal aging. But what if it is not aging? What if the real problem is sitting inside your medicine cabinet? I'm Dr. Emily William, and today I want to talk about something every adult, every senior, and every caregiver needs to understand. Some very common medications can cause memory problems, confusion, brain fog, and dementia-like symptoms, especially in older adults. And here is the important part. I am not telling you to stop your medication. Never stop a prescribed medicine suddenly without your doctor's guidance. Some medicines can be dangerous to quit abruptly, but I am telling you this. If your memories started getting worse after a new medication, a higher dose, or a combination of pills, that is not something to ignore. Stay with me until the end, because the final section may be the most important. It is not one single pill. It is the combination of medicines that quietly builds up in the body and makes a person look like they are developing dementia, when the real issue may be medication burden. Now let's begin. Number 1. First-generation allergy and sleep medicines. The first medication group is one of the most common, older allergy medicines and nighttime sleep products. The best-known example is diphenhydramine, often found in allergy pills and many PM sleep products. People take it for allergies. They take it for itching. They take it for colds. They take it to sleep. And because it is sold without a prescription, many people assume it is harmless. But inside the brain, these medicines can block a chemical called acetylcholine. Acetylcholine is important for memory, attention, learning, and alertness. When this chemical is blocked, especially in older adults, the brain can become slower. Think of acetylcholine like the signal between light switches in your house. If the signal gets blocked, the lights may still be there, but they do not turn on properly. That is what some people feel as brain fog. They become forgetful. They feel sleepy during the day. They become confused. They lose focus. They may even become unsteady and fall. This does not mean everyone who takes one allergy pill will develop dementia, but frequent use, especially in seniors, can become a real concern. If you are using a nighttime allergy pill to sleep every night, talk to your doctor or pharmacist. Ask whether there is a safer option for allergies or sleep. The warning is simple. Over-the-counter does not always mean safe for the aging brain. Number 2. Bladder control medicines. The second group is bladder control medicines, especially older anticholinergic drugs used for overactive bladder. A common example is oxybutynin. These medicines can help with urgency, frequent urination, and bladder accidents, and for many people, that relief matters. Nobody should be embarrassed about bladder symptoms. They are common and treatable. But some bladder medicines work by blocking acetylcholine. That is the same memory-related chemical we just discussed. Now imagine an older adult already taking one anticholinergic medicine for sleep, then another for bladder control. The brain does not see them as separate problems. It feels the combined effect. This is why someone may start a bladder pill and then notice more forgetfulness, trouble concentrating, confusion, dry mouth, constipation, sleepiness, dizziness. And because these symptoms appear gradually, families often blame age. But sometimes the timeline tells the truth. If memory changed after starting a bladder medicine, ask the doctor directly. Could this medicine be affecting memory? Is there a non-anticholinergic option? There are alternatives for some patients, but only your doctor can decide what is appropriate for you. Number 3. Benzodiazepines for anxiety or sleep. The third group is benzodiazepines. Examples include alprazolam, lorazepam, diazepam, clonazepam, and similar medications. These drugs can calm anxiety and help with sleep. For short-term use in the right situation, they may be useful. But in older adults, long-term use can become risky. They can cause memory problems, slowed thinking, daytime sleepiness, poor balance, falls, confusion, dependence, worsening brain fog. Many people describe it like living behind glass. They are awake, but not fully clear. The danger is that benzodiazepines can make a person look like they are declining mentally when the brain is actually being chemically slowed down. And here is the most important warning. Do not stop benzodiazepines suddenly. Stopping suddenly can cause severe withdrawal, rebound anxiety, insomnia, agitation, and in some cases, seizures. If you have been taking one for weeks, months, or years, speak with your doctor about whether a slow taper is appropriate. There may be safer long-term options for anxiety or sleep, including non-drug therapies, sleep treatment, or other medications, but the change must be supervised. Number 4. Strong sleep medicines. The fourth group is prescription sleep medicines and sedatives. Many people take sleeping pills because they are desperate. They have not slept properly for weeks. Their mind races at night. They wake up exhausted. I understand why people reach for relief. But sleep medicines can affect memory, balance, and next-day alertness, especially in older adults. Some people wake up feeling heavy, foggy, and disconnected. Others do things at night they do not fully remember. Sleep is supposed to repair the brain, but deep sedation is not the same as natural sleep. Think of natural sleep like charging your phone properly. Sedation can sometimes feel more like turning the screen off while the battery is still not fully restored. If you need sleep medicine often, it is worth asking, what is causing the insomnia? Pain, anxiety, sleep apnea, restless legs, caffeine, nighttime urination, depression, medication side effects? Treating the cause is better than covering the symptom every night. Number 5. Older antidepressants with anticholinergic effects. The fifth group is older antidepressants, especially tricyclic antidepressants such as amitriptyline. These medicines may be prescribed for depression, nerve pain, migraines, or sleep. Sometimes they are used at low doses, so people assume the risk is low. But some of these medications have strong anticholinergic effects. Again, that means they can block acetylcholine, the memory and attention chemical. In older adults, this can lead to dry mouth, constipation, urinary problems, blurred vision, drowsiness, confusion, memory trouble. What makes this tricky is that the person may not even think of it as an antidepressant. They may say, "No, I take it for nerve pain," or "I take it for sleep." But the brain still responds to the medicine's chemistry. If you or a parent takes amitriptyline and memory has started slipping, do not panic and do not stop suddenly. Ask for a medication review. There may be other options depending on why it was prescribed. Number 6. Some antidepressants that are less ideal for older adults. The sixth group is certain antidepressants that may be more problematic for older adults than others. One example often discussed in geriatric prescribing is paroxetine. Paroxetine is an SSRI, a type of antidepressant. Many SSRIs are commonly used for depression and anxiety. But paroxetine has more anticholinergic activity than many other SSRIs, which is one reason it is often flagged as potentially inappropriate for some older adults. This does not mean every person taking it is in danger, but it does mean that if an older adult is taking paroxetine and experiencing memory problems, confusion, or mental fog, it deserves a conversation. The key question is not, is this medicine good or bad? The better question is this the best medicine for this person at this age with these symptoms and these other medications? That is how smart medication decisions are made. Number 7. Antipsychotic medicines used for sleep or agitation. The seventh group is antipsychotic medicines. Examples include quetiapine, risperidone, olanzapine, and others. These medicines can be necessary for certain psychiatric conditions, but sometimes they are used in older adults for sleep, agitation, restlessness, or behavioral symptoms of dementia. This is where caution becomes extremely important. Antipsychotics can cause sedation, slower thinking, stiffness, falls, and worsening confusion in some older adults. In elderly patients with dementia-related psychosis, antipsychotics also carry serious safety warnings, including increased risk of death. That does not mean they are never used. Sometimes doctors use them when symptoms are severe and safety is at risk. But they should be used carefully, with a clear reason, at the lowest effective dose, and reviewed regularly. If a loved one is in a nursing home or care setting and was started on an antipsychotic, ask, why was it started? What symptom is it treating? How long will it be used? Can the dose be reduced? Are there non-drug approaches first? Sometimes agitation is not psychiatric. It can be pain, infection, constipation, dehydration, poor sleep, hearing loss, loneliness, or overstimulation. Treat the cause, not just the behavior. Number 8. Opioid pain medicines. The 8th group is opioid pain medicines. These may include medications such as oxycodone, hydrocodone, morphine, tramadol, and others. Pain can destroy quality of life, so pain treatment matters. But opioids can also affect the brain. They may cause sleepiness, slowed thinking, confusion, constipation, dizziness, and falls. In older adults, these effects can appear even at doses that younger adults tolerate. The person may seem less sharp, they may nap more, they may forget conversations, they may become confused at night. And if opioids are combined with benzodiazepines, alcohol, or sleep medications, the risk becomes much higher. This is not about blaming pain patients. It is about making pain treatment safer. If memory or alertness changed after starting opioid pain medicine, speak with the doctor. Ask whether the dose, timing, or treatment plan can be adjusted. Sometimes physical therapy, topical treatments, nerve pain medications, injections, or non-opioid approaches may reduce the need for stronger sedating medicine. Pain relief should not cost a person their clarity if safer options exist. Number 9. Anti-seizure and nerve pain medicines. The 9th group includes certain anti-seizure medicines and nerve pain medicines. Some are used for epilepsy, others are used for neuropathy, shingles pain, fibromyalgia, or chronic pain. These medications can be helpful, but they can also cause dizziness, sleepiness, slowed thinking, and memory trouble, especially when doses are increased quickly or when kidney function is reduced. This matters because kidney function often changes with age. A dose that was fine years ago may become too strong later. If an older adult becomes suddenly foggy after a dose increase, do not assume dementia appeared overnight. Ask whether the dose is too high, whether kidney function was checked, or whether other sedating medications are adding to the effect. Sudden confusion is often not dementia. Dementia usually develops gradually. Sudden confusion may be medication side effect, infection, dehydration, low sodium, low blood sugar, or another urgent problem. That difference can save someone from being mislabeled. Number 10. The biggest hidden danger, medication burden. Now we reach the most important part. Sometimes it is not one medicine, it is the stack. A sleep pill, a bladder pill, an allergy pill, a pain pill, a nerve pain pill, a stomach pill, a depression pill. Each one may have a reason. Each one may have been prescribed by a different doctor. Each one may look acceptable alone. But together, they can overload the brain. This is called medication burden or polypharmacy. Think of the brain like a room with 10 dimmer switches. One medication turns the lights down a little. Another turns them down more. Another affects balance. Another affects memory. Another affects sleep. Eventually, the room is not dark because of one switch. It is dark because too many switches were lowered at the same time. That is why a medication review is so powerful. A doctor or pharmacist can look at the full list and ask, which medicines are still needed? Which are duplicates? Which increase confusion or falls? Which have anticholinergic effects? Which can be reduced safely? Which should never be stopped suddenly? Which safer alternatives exist? This is especially important after age 65, after hospitalization, after a new dementia diagnosis, after a fall, or any time memory changes quickly. The 5 warning signs your medication may be affecting your brain. Here are the signs to watch for. Number 1. Memory worsened after starting a new medicine. Number 2. Confusion appeared after a dose increase. Number 3. The person became sleepy, flat, or not themselves. Number 4. Balance worsened or falls started. Number 5. Symptoms improved when a medicine was missed or reduced, even accidentally. Do not experiment on your own, but write these patterns down and tell the doctor. The timeline matters. What you should do this week. Here is your action plan. Gather every medication in one place: prescription pills, over-the-counter sleep aids, allergy pills, pain medicines, bladder medicines, supplements, herbal products. Put them in a bag and take them to your doctor or pharmacist. Ask these exact questions. Can any of these affect memory or cause confusion? Do any have anticholinergic effects? Are any unsafe for older adults? Can any be reduced or replaced? Which ones should never be stopped suddenly? Is there a safer option for sleep, anxiety, bladder symptoms, pain, or allergies? This conversation can change everything. Some people regain mental sharpness when the right medicine is reduced or replaced safely. Not always, not in every case, but often enough that it should never be ignored. Final message. Dementia is real. Aging is real. Alzheimer's disease is real. But not every memory problem is dementia. Sometimes the cause is medication. Sometimes it is a drug interaction. Sometimes it is too many sedating medicines. Sometimes it is an anticholinergic burden that nobody added up. The tragedy is when a reversible problem is mistaken for permanent decline. So please, do not stop your medicines suddenly. But do not ignore brain fog either. Ask for a medication review. Ask about safer alternatives. Ask whether your memory symptoms match the timing of a new pill. Ask until someone takes the question seriously. If this video helped you, comment below. Which medication group surprised you most? Allergy pills, bladder medicines, sleep pills, anxiety medicines, pain medicines, or the combination of many medicines? And share this video with someone who takes several medications every day. One careful medication review can protect memory, independence, and quality of life.